Hello. Hello, guys. Hi. I'm back again. This is Dr. Echefu, your favorite girl. This is Dr. E, hairloss coach, hairloss physician, transplant physician, hair transplant physician. I'm going to be inviting Dr. Patil right now. So we're going to be talking about all things hair loss, connecting your hair loss with every other medical. Hi, Dr. Patil.
Hello.
Thank you so much for
Good
coming.
morning.
Good morning. You look awesome.
It's you too. It was funny.
Thank you.
We have a snowstorm here and our power went out and I just thought, oh my gosh, how am I going to log
I
in?
saw
But we,
the email right before. I
yeah,
was like, okay, I just responded to the email. I'm like, don't worry, I'll just respond to it. Can you at least use your
yeah,
phone? That's what I
yeah.
said
So
to you.
I'm on my phone now
Okay,
and hopefully this
it
works and
works.
the cellular
Okay,
holds steady.
we're
But
going to
yeah,
make
thank
it
you for
real
having
sweet.
me.
Thank you. You're welcome. Thank you so much for coming. I know how busy everyone is.
Yeah,
So I'm always appreciative of my guests coming on my,
yeah,
show. Okay. So we're going to get right into
sure.
it. So, Dr. Patel, tell us who you are. Who the
Okay, I will
pleasure
do
do
that.
we have talking to today?
Yes. I am Komal Patil Sisodia. I'm an endocrinologist by background. I'm also board certified in obesity medicine, and this last year I got my Menopause Society certified practitioner credentials as well. And I've been practicing since 2009, and I've been back in my hometown since 2014. So I'm back in the community practicing where I grew up in Washington State. Yeah,
Awesome.
so love what I do.
Wait,
Feel very, very blessed to do
wait,
it.
wait, hold on. People didn't get what basically you just threw a bomb at us right now. Like you threw it so many. So you're an endocrinologist,
Yeah,
obesity medicine specialist.
yeah.
Now you also menopause practitioner now. So you have
Yeah,
to kind of break it down a little bit for us so that people understand who is an endocrinologist,
sure.
then obesity medicine, and menopause practitioner.
Absolutely. So, an endocrinologist is somebody who specializes in hormone disorders in the body, right? More commonly, people will think that, think of diabetes or thyroid disease or the less common endocrine glands, like, or not less common, but less affected, but still can have issues like the pituitary gland, adrenal gland. A lot of times, reproductive hormones like what regulates our menstrual cycles that goes to gynecology, but I know more and more endocrinologists are stepping into that because it is all interconnected.
Interconnected.
And we see not necessarily like reproductive issues in how you would go see like a fertility specialist, but we deal with a lot of polycystic ovarian syndrome, which I know is a big cause of hair loss, and we'll dig into that a
Yes,
little bit
we
later.
will
But
definitely.
that is something that I see come through my office fairly frequently. And then obesity medicine was something that I was interested in because my patients who have diabetes and then also those who have PCOS really struggle with their weight. And so I thought that would be a nice
Adam.
adjunct to what it is that I
Mm-hmm.
do. Yeah. And
Awesome.
then more and more recently, I'm noticing that a lot of women who are in their early to mid 40s, sometimes even like late 30s, are ending up in my office saying they feel terrible and it must be their thyroid or adrenals or something. And it's not, it's perimenopause. And we do not do a good job of talking to women about what happens to their bodies during that. And we have estrogen receptors from head to toe. So that is another cause of hair loss that I think we underestimate for women. And so I decided last year that I wanted to make sure that I was looking at the complete picture for my patients who were coming in to see me. So I sat for those credentials.
Awesome.
So yeah,
Maybe I need to come to you to get certified with menopause because half of my patients,
I totally believe it, right?
half of my
And
patients, I can't even
yeah,
tell you, half of
and
my patients.
it's so distressing, right? Because our hair is so tied to our identity and to our femininity and all of these things. And when you are going through, I often tell my patients that change is really the only constant that women know, right? Our bodies
Yeah.
are changing all the time. From the time we are kids, then we hit puberty. You hit puberty, then you hit your reproductive years. If you choose
Yeah.
to or are able to become pregnant, that's another change. And then because we are having kids a little bit later compared to previous generations, perimenopause and menopause come right after that, right?
Uh,
And so it's this constant state of flux that our hormones are in. And I
yeah.
think we underestimate what that does to our bodies, and then very specifically, the topic we're going to talk about today, how that affects our hair, right?
Yes, yes. I'm telling you, half of my clients, like, I'm like, you need to go see your OBGYN, but I'm so glad that you actually, went further than just
Yeah,
endocrinology. You went into obesity medicine and menopause because every time people ask me that, why am I inviting doctors? We just talk about hair loss. I'm like, I'm not talking about hair loss.
yeah,
What you have to understand, I'm talking about how did the other disease processes can
yes,
lead to that because I see a client tomorrow, and I saw a client yesterday. She was crying. I had to go into her mental history.
yeah,
I saw a client last week, and she
yeah,
was gaining so much weight. I'm like, okay, I need to send you
yeah,
to someone that does obesity medicine.
yeah,
You see,
yeah. It's
so I'm just like a piece of the puzzle. So
yeah,
But that's why it's so important when I invite doctors. I like to understand, what they do, and pick their brains and talk to them so they can give us more information. Because sometimes some of my clients say, "Oh, I listened to this talk you did with this doctor. It made me think, like, think what do I need to talk to my primary care doctor? Do they need to do more? So it
yes,
makes them think more and all that. So thank you so much. Okay, so you've basically gone through everything.
yeah.
I mean, you've told us everything you do. So now, how can people connect with you?
That's a great question. So they can find me online at my handle at Dr. Patil Sisodia. And then I also have a podcast that I host called Reset Recharge, where I have been talking about bringing awareness to all of the metabolic
Mm,
changes that happen to women during this perimenopause transition. I often, joke that as soon as we're not able to reproduce, all of these chronic illnesses that take us out of the gene pool start to go up, right? and
yeah,
and it is serious, right? It's not really so much a joke, but because we're not educating women about what is happening to their bodies, a lot of times these things get delayed
that's
until
right.
they become processes that you have to start treating with medication, right? But if you are intervening early and putting in lifestyle changes or really looking at what your genetics have in store for you,
Mm,
you can be a lot more proactive
more
than we are led
proactive.
to believe, right?
That's
So
right.
that's kind of my mission, is to connect with women so that we know what's happening in our bodies and we can take control of our health.
That's right. Are you able to do tele consults? Do you have
Yeah, that's
so
a
I can
great
refer
question.
my clients?
I do, but I unfortunately only for the state of Washington right
Okay,
now.
got it.
I do have my California license, and I'm looking into whether that will be a possibility. I practice in a traditional healthcare system, and then I am also next month launching my menopause micro practice, which will be my own private thing on the side,
Awesome.
and that'll be on Friday. So people who are in the state of Washington or willing to
Mm-hmm.
travel to the state of
Mm-hmm.
Washington, I know it's way up in the corner over there.
But that's okay. If we
But if
want it,
people
we'll
are,
come to you.
yeah, if people are willing to come see me in
Mm-hmm.
person, for telehealth visits, you have to, based on Washington state laws, you
Washington
have to
State.
be
Yeah,
physically present in the state.
got it.
So
So
yeah,
hopefully you'll be able to make a lot of videos, programs, something we can watch,
yes,
just keep
that
us
is the goal.
update. Yes, keep us updated. And I want to
Yes,
watch all those things. That's good. So now that our first question, it's not
yeah.
really a first question. I've asked you like, two questions. So how often do you meet people with hair loss?
Oh my gosh, it's so much more common than
Mm,
we acknowledge it. And I will tell you, like I was having hair loss
mm,
and I went to see my dermatologist for a rash, and I was so grateful to her because she said to me, "Are we going to talk about the fact that your hair is thinning?" And
mm,
I was like, "No, no, no, it's just stress." And she said, "Oh, honey, no. Let's talk about this and let's see what all the different causes could be," right? And she actually helped me embrace that even for myself. So there was a
mm,
period of time where my hair was really thinning, and I think we don't talk about it because there is a shame and a stigma attached to it, and it's really scary to make yourself vulnerable in that state, right? So
mm-hmm.
there are a lot of different conditions that come through my door for hair that some of the complaints are hair loss, or I notice that when the patient's
Yeah.
sitting there in my office, that their hair is thinning, right? So for thyroid disease, when your thyroid levels are either too high or too low, that disruption to your metabolism can cause pretty significant hair loss, right?
Loss.
So
That's right.
really getting your thyroid levels in line will help stop that hair loss. But I think the hard thing for patients is we lose our hair so much faster than it grows back, right?
That's right.
So it's the patience of waiting for it to come back.
Come back.
Exactly. It's not uncommon for people to be so distressed about their hair falling out that they will come to me with like the hair they've collected in their drain and in their
Mm.
hairbrush and in bags to show me how much hair they're losing. I'm sure you see that too,
Oh
right?
yeah, oh
Yeah.
yeah, oh yeah, oh yeah. So usually now, so when you see a client suffering from hair loss, or you
Yeah.
notice that they have hair loss, do you usually refer them back to their primary care doctor to get more tests on them, or you go ahead and just say, hey,
Yeah.
I can order this test for you? And what do
You
you
know,
usually recommend? Like, you know?
Yeah, that's a great question. I used to do that, and then I realized I was seeing it so much, right? And it is a big part of polycystic ovarian syndrome, which can cause thinning of the scalp hair. So
Mhm.
I tend to now run the test myself, right?
Okay,
And what I usually tell my patients is let's find and see if we can find a medical issue that is contributing to your hair loss and see if we can correct that and give it the adequate amount of time for your hair to spring back.
okay,
And if not, then going to see a dermatologist or a hair transplant specialist for yourself may be the next steps, right?
maybe.
So,
Okay.
yeah.
So
So
what
I'll, do-
the first
I'll go
test usually? Yeah.
yeah, the test that I will usually order will, thyroid tests are my first and foremost,
Mm-hmm.
right? Then I see a lot with iron deficiency,
Mm-hmm.
so I'll do an iron panel, a
Mm-hmm.
CBC, vitamin D, vitamin B12. I have a lot of patients in this area of the country who are vegan, and B12 deficiency I think is underrated for what it
That's right.
can potentially do for your hair. So I've
Mm-hmm.
seen some people be able to improve from that. And then for polycystic ovarian syndrome, that's kind of an interesting condition in that we call it a diagnosis of exclusion, right? There are many other things that can contribute, but it's also kind of a spectrum of disease.
Mm-hmm.
And what we will usually see is we'll see elevated levels of androgens, like testosterone, which are, traditionally what we call the quote unquote male hormone. I don't really love that term because testosterone is present in women too, and it's
Me too.
important for our bodies. Um, but it can be what we call pathologically elevated testosterone, meaning it is much higher than what our body needs it to be. And that can cause pretty significant scalp hair loss, as well as increased facial hair and body hair, which is doubly distressing, right?
Can I ask you a question? You
Yes.
know, a lot of my PCOS clients, they come and like, how do I come and have hair every other place, but I'm losing it?
Right.
They do not actually understand that.
Yeah. And it is the worst. It is so distressing,
Mm-hmm.
right? Because and you look at different ethnic groups and like Indian people or people from the Middle East or the Mediterranean, there are some ethnicities that tend to have more facial and body hair in general.
Mm-hmm.
But you can tell the difference when it is what we call pathologic or causing a medical problem versus something that is just tied to what your ethnicity is, right? And so I think that is also a big distinguishing factor. And with PCOS, in addition to these changes that you see with your hair on your scalp or on your face, a lot of women are also having irregular menstrual periods. They've never been regular since they hit puberty, or they were regular for a short while, but then it shifts. I see in some of my PCOS patients, they gain a significant amount of weight and they develop what we call insulin resistance, which is kind of the precursor to prediabetes and diabetes. And what happens there is when you are gaining weight and you're gaining that weight, especially around your middle, right? That's not sitting under your skin. It's actually going inside your abdominal cavity and causing what we call insulin resistance. And that means you need more insulin to process the food that you're eating. So your body has to produce more and more insulin. The interesting way that that works in PCOS is that that increased amount of insulin will go to the level of the ovaries and cause more testosterone production. It will also,
Got it.
our testosterone will circulate through our body,
Mm-hmm.
either free or bound to a protein that kind of
Mm-hmm.
carries it through to different parts, called sex hormone binding globulin. What that extra insulin can also do is knock the testosterone off of like the little thing it's riding on and make it more active, right? So it's creating all of these issues that are then contributing to the facial
The
hair, the
facial
body
hair.
hair, the
Mm-hmm.
scalp hair loss.
Mm-hmm. Yeah.
Yeah.
Because okay. So let me ask these questions. I'd like to.
Yeah.
What one of our audience said, as an
Yeah.
endocrinologist, what can you say about relaxers on hormonal imbalance?
Relaxers as in like,
Perms, when people use
oh,
perm.
perms.
Yeah, but we call it
Yeah.
relaxers,
Ah,
perm.
that's
Yeah,
a good question.
yes.
There are a lot of articles that are now coming out about certain chemicals being endocrine disruptors, and
Mm.
I think specifically for the relaxers that we see, I'm not aware of any data, but I am definitely going to go look that up. I wouldn't be surprised if there is a correlation, right?
Especially in Afro. Yes,
Yeah,
yes, 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 yes. Yeah,
that's an
yeah,
excellent question.
yeah. So
But
that's what
I'll
she
get
wanted to know.
back to you with that, and
Yeah,
I'll send you some
definitely. Letitia, I
information.
will definitely.
Yeah.
She's gonna. I'm telling you, she's gonna inbox me or DM me, and I was like, "Don't forget my
Yeah,
question," and I'm gonna get back
I
to
won't forget your question.
you. Okay. So anyway, so you said so the first. I'm just gonna kind of go back a little bit. So you
Yeah,
said usually the first test you recommend, because physicians also watch this, nurse
yeah,
practitioners like hair loss
yeah,
practitioners and
yeah,
trichologists, so they can advise their clients the right what to do. So you say usually the first test you recommend is thyroid
yeah,
hormones, TSH, then
yes,
the iron, the
yeah,
ferritin,
hmm,
then the CBC just to know their hemoglobin level
yeah,
and all that. That can actually point to if they're iron deficient and all that, because if their
yeah,
hemoglobin is low. Vitamin D and vitamin B12, especially for vegans. That's what you
yes,
said.
yes,
Yes. And you also talked about PCOS, the testosterone level, and
yeah.
the sex hormone binding globulin,
Right.
right?
And I will also check for them what we call a DHEAS, which is, oh my gosh, I'm not going to remember the full thing.
Don't worry, I know what
And
that the DH.
aldosterone
I know.
sulfate. Yeah,
It's a
you
long
know what I
name.
mean. So
I know what you mean.
DHEAS,
I'm good.
the acronyms are
Yes,
terrible.
yes, yes.
But yes, the DHEAS is something I will check. I also check a fasting glucose level as
Okay.
well as the hemoglobin A1C, right? Because if your fasting glucose is elevated and your hemoglobin A1C is elevated, your hemoglobin A1C is your 3 month snapshot looking back at what your blood sugars are doing, right? And so if
Mhm.
those two are elevated, you know that you have a little bit of insulin resistance going on that could contribute to the hair loss as
Mm.
well, right? And for all the ways that we described before as we were talking about it.
So let me throw you a little bit question, a little bit
Yeah.
tricky question. So I pray you don't get into trouble answering
No.
this. So now people say when someone is on the heavy
Yeah.
side, that
Yeah.
definitely they have diabetes. People always think they have diabetes. How true is that?
That's a great question. I would say that is not always true, right? I there are a lot of people who live in bigger bodies, right,
Mm-hmm.
who are classified as having overweight or obesity,
Obesity.
and they don't necessarily have that metabolic impact yet, right?
Mm-hmm.
And that's why I really believe that preventative care is important
Is
because you can
important.
track those changes, right? I really our blood sugars are considered normal if they're less than 100, right? But if 5 years ago your fasting blood sugar was 80, and the 5 years before that it was 70, and the 5 years before that it was 65 or something like that, but it's tracking
Mm-hmm.
up and you're skirting the edge of 99, and you can see looking back at your labs that you have that trend, you could be developing that insulin resistance, right? And so
Mm-hmm.
it's a tricky thing to talk about because weight itself is a sensitive topic, right?
Yes.
But not everybody who is overweight has developed prediabetes yet,
Diabetes.
right? And a
Yes.
lot of
Yes.
that I think has to do with body composition and where our fat tissue sits,
Mm-hmm.
right? If you tend to carry a lot of your weight on your arms and legs and it is sitting under your skin in that area, and you don't have as much around your middle, you may not be as insulin resistant as a person who carries most of their weight in their middle.
Okay.
Yeah.
Good. So she asked another question.
Yeah.
What is the highest level of vitamin D that would trigger help to someone with hair loss and also to
Uh,
help with insulin resistance?
yeah.
Okay,
So
maybe I
that's
don't know
a
if this is the same question or two questions in
yeah.
one. I think, yeah.
So this is a good question. I think when vitamin D deficiency first came out as a condition, we saw that it was, being associated with everything, right? If something is prevalent enough, we think that it can be associated with a lot of different things. And I know for a fact that the vitamin D deficiency really affects bone density the most, right?
Yeah.
That's what I see most commonly in my
Yeah.
practice for people who come in with low bone density or osteoporosis. And the recommendation around that has usually been to keep people's vitamin D levels between 30 and 50. If you look
Yes.
at the general population, especially depending on where you live, up to 80-90% of people can be vitamin D deficient. In Seattle,
Yes.
I mean, we're 9 months of gray skies, so we are all vitamin
Already
D deficient up
deficient.
here. So I
Yes.
usually aim for 30 to 50. That
30
is
to 50.
reasonable, right? As you start approaching 70, 80, that's where you start running into the issue of vitamin D toxicity, where if you have too
You
much, that's a
have
problem
too
too.
much.
Yeah,
So because I saw online, I think someone was saying that she encourages her clients to take vitamin D
yeah,
once a week. Tell your regular, I'm like, but if your vitamin D levels are normal,
yeah,
why is the person taking high doses of
yeah,
vitamin D? Like, it doesn't make sense. The person was saying it improves
yeah.
it helps decrease fatigue, it helps your energy levels. I'm
No,
like, is this based on your experience or based on, is this science, is it proven? So people
right.
basically put out things because it helped them.
Yeah.
So they
And
think that
it's
is what it's supposed to. Yeah.
Yeah, and it's scary, right? Like
Hmm.
I will have my patients come in and they will have like bags of vitamins that they're taking. And sometimes we don't read the labels properly. I've had a few patients who've come in and had like very high toxic levels of vitamin D. And what that will do is that will actually raise your blood calcium levels over time.
Calcium.
And
Hmm.
that can put you at risk for kidney stones and other things. So I totally agree with you, right? I mean, one of the scariest things is that there is not enough good quality information out there.
Yes.
And there are a lot of people out there who are speaking from their personal experience as opposed to what is based in
Based,
science.
evidence based.
Yes.
So now every time I go for a hair loss lecture, I speak to trichologists, everyone, everything hair loss. The first question they always ask me is about zinc, vitamin D,
Hmm.
that should they continue taking it? So people are so focused on just taking vitamins instead
Yeah.
of going to their doctor, checking their
Yes.
levels, and doing the right thing.
Yeah.
So what do you say about that?
I think it's really important to talk to your doctors,
Hmm.
right? And unfortunately, we live in a time where information is very accessible
Hmm.
online. There's also been a big mistrust of the medical community that's developed over the last several years, right? And a lot of it has to do with what happened before our time as coming into the industry as doctors, right?
Hmm.
About people who were practicing several decades ago who were overdoing procedures, overdoing tests, or prescribing meds, and then now you have government regulation that stepped in, and we now have to see more patients in a shorter amount of time, and you don't have that time to connect with somebody, right?
Hmm.
So there's a lot of stuff that we're dealing with when it comes to mistrust of science and mistrust of physicians. But relying on what somebody is telling you online that does not have the credentials, that has not done the work to study these things, it's
Hmm.
going to be dangerous for you, right? Like the zinc question is a really good one, right? I have a lot of patients who come into my office and they're loading up on zinc, especially during the winter months, because they think that that is going to help them fight off any colds or viruses. What a lot of people don't know is that if you overdo the zinc, you can inadvertently give yourself a selenium deficiency. And the selenium deficiency, oh no, sorry, copper deficiency. I misspoke. Copper
Okay.
deficiency. And the copper deficiency will feel almost like hypothyroidism, right? And
Mm.
these are not things that we normally check because most people aren't out there taking gobs of zinc, right? It's not something that triggers in your brain, but that is a real possibility. So,
Mm. Okay.
yeah.
Okay. So, are you trying? Is the mechanism of action? It has excess intake of zinc. Is it? How does that function with the copper?
I think it depletes the copper.
Deplays the
Yeah.
copper.
So you
Got
have
it.
to replace both, right? But what is the right amount? I don't actually know, right? And that's the scary thing is people are coming in taking supplements in that are, supplements are not studied in the same way medications are because they're considered a food additive,
That's right.
right? So if you go through that study and what you get in a supplement can be quite a lot. Yeah.
Okay. So I have another question. So
Yeah.
I also saw someone saying, how do you know you have zinc deficiency if you have hair loss right here?
Yeah.
Hair loss right here. So someone kind of was saying, how do I know you have vitamin D deficiency? You have hair loss right here. So they kind of divide their hair loss into zones and say
No.
zone one is vitamin D deficiency. Zone 2 is zinc. I'm like, have you ever heard of that? Have you ever seen
I
someone? Have you ever tested someone based on the different? I'm just asking.
no.
This is what
I mean, that's a great question. I haven't heard that yet, but I will be on the lookout for that. That is
okay.
wild.
I just want to make
Yeah.
sure because sometimes when I say it, it sounds a little bit abrasive. But once two physicians,
Yeah.
say the same thing, like they're like, okay, there's really nothing like that. So,
No, not that
so,
I've seen.
so Letitia also asked another question: is it true that excess of biotin causes false detection of
Yeah.
thyroid?
Yes, this is something that I talk to a lot of my patients about, right? Because people are struggling with hair loss. They're taking prenatals or they're taking the biotin supplements you can get at Costco. And when you are on biotin, it can interfere with the thyroid assay, the lab assay. So usually what I will tell people is they have to hold their vitamins for a minimum of 3 days prior to going and getting those labs drawn. Usually a week is better, but if you don't want to be off of it for that long, 3 days is acceptable.
Okay. So
Yeah.
she said, does it affect all the function of the thyroid panel or just specific like TSH or T3 or T4?
I think it's
Because
mostly the TSH. I
it's the
think there can
TSH.
be some issues with the T4 as well, but I see it mostly affecting the TSH.
TSH, does it give false elevation or false
It's variable.
okay,
It just makes,
variable?
yeah, it's variable. So if somebody has taken it, I usually ask them to repeat it within a few weeks just after they've been off of the biotin for a few days.
So is there like a recommended dose of the biotin that affects? Because I have like a hair vitamins
Hmm.
nutraceuticals that has biotin. I think it's like 10,000 micrograms.
Yeah.
So but I'm very careful telling someone to take that. I have to make sure that they don't have any other medical condition or
Yeah.
something else before they take that. But is there any recommended dose
Not
that can affect that, or it's just
Well,
because of
I think it's
sustained?
just any biotin in general. I would say
Okay,
even the lowest dose, like I think the lowest dose supplement I've seen somebody bring into me is like 2,500 milligrams.
okay.
And even that can throw off the lab
That
test.
can throw off the
Yeah.
okay. So it's just the only recommendation is to stop it 3 to 7 days
Yes,
before you actually get your thyroid hormones checked.
correct. And then your
Okay.
thyroid test will be fine. They
Okay.
won't be affected by the biotin.
So just in case their regular doctor forgets that they are taking the biotin and they call them and say, hey, your thyroid hormone, you might problem with your thyroid, you might need to start taking
Yeah.
thyroid medication. They might need to check within themselves, hey, I take biotin, doc, can I recheck the
Yes.
test? So it's okay for them to let their doctor also know that.
Yes, absolutely. Because it's not always common knowledge. I mean, you and I both know there's so much to know in medicine. There's no way that one person can know it all, right? So
Yes, that's right. Bring it on, Letitia. See, they were waiting for you. I'm sure they
I love this. I
they
love
were waiting for you. They're like, I'm gonna ask her all the questions.
I love that so much. Yeah,
I
and I
promise
have
you.
to
Look at my
answer
notes. I'm writing.
it.
Look at my notes. I'm
I love that.
so we're ready for you. Thank you so much for
Oh, it's
giving
such a
us all
pleasure to
this
be
because
here.
this really helps. It's not just physicians, also people that hair loss coach, hair people that anything trichologists, barbers, hairstylists that
Yeah.
follow me. They ask me all these questions, and that's why I try to bring physicians. I just don't want to bring the best in the game.
Yeah.
I bring physicians that this is what we've been practicing. This is what we've lived all our lives for.
Yeah.
This is basically what we see day in, day out.
Yeah.
Even when you don't
Right.
want to see it, when you leave the hospital or your clinic, you see it online and you get frustrated.
Exactly. Exactly.
So the right information is very, very important. Thank you so much. So
Oh,
now a lot of people, like I also talked to you about, PCOS.
yes.
Tell me a little bit, how often do you see PCOS with hair loss? Do they always have hair loss,
I would say
or is just?
I would say the majority of the time,
Mm-hmm,
yes, right? There's a like before I was saying PCOS is a spectrum of a disease, right?
mm-hmm,
There are many different criteria or three different criteria, main criteria that you have to have in order to be, you need two of the three to be diagnosed with PCOS, right? So
okay.
what one is what we call anovulatory cycles, where you are menstruating, but you're not necessarily ovulating, right? And then it will be that increased androgen levels can be part of it, and then the cysts on the ovaries, right? And the it's interesting that they call it polycystic ovarian syndrome because the cysts on the ovaries are only present in about 25% of people. Not
Hmm.
everybody has cysts on their ovaries. So I actually think of it more as a metabolic syndrome, right? Because what I see is that for the women who have the elevated level of androgens or who are developing that insulin resistance, they have like triple to quadruple the risk of diabetes and heart disease in their future, right?
Mm,
And that is really the long-term implication that we don't talk about. I think for a lot of us as women, we are very upset by when our cycles are not regular or
regular.
it's impacting our fertility. And that is definitely a part of it. But after that is said and done, you have this increased lifetime risk of developing these other things. And that's where I think we need to talk, have a more complete conversation around that.
But you know that a lot of ladies don't know they have
They
PCOS
don't.
until it's time to give they start dealing with fertility issues,
Yes.
or when they come in with hair loss. Then we
Yes.
have to now ask them, are your cycle are your is your menstrual cycle regular, irregular? Then we start then I'm
Yeah.
like, okay, this checks it. You need to go have that checked out.
Yes.
Like,
Absolutely.
so, so this is very important, like, PCOS. So, and it's not everyone that has cyst. The very most important thing I have to know today, it's not everyone that has cyst
Yep.
in
And
their
that I
ovaries.
think is what throws a lot of women off
Mm-hmm.
from getting diagnosed, right?
Mm-hmm.
Because you think, of course, the condition's called polycystic ovarian syndrome. If I don't have cysts on my ovaries, I must not have it. But 75% of women with PCOS don't have those cysts on their ovaries. And
Mm-hmm.
it's really that, those irregular cycles, all of the other things that we talked about. And we call it in endocrinology a diagnosis of exclusion, meaning you
Exclusion.
rule everything else out first before you get to that. And I think that's part of why women are really underdiagnosed, right? One,
Underdiagnosed.
it's hard enough being an adolescent woman and going through all those changes in your body. And a lot of times, what I'll see is classically like women will hit puberty and then all of a sudden gain a lot of weight, right? Develop
Okay.
that hair loss, develop acne. Acne is something also that we see in PCOS that we don't
Mm-hmm. Yeah.
talk enough about. Um, and the whole time you're as a young woman you're dealing and struggling with body image and not wanting to talk to people about this. It's a tough topic to talk about when your body goes through so many different changes. So I think there is a delay in diagnosis, which
That's right.
makes me very sad.
So Letitia has two questions. She said,
Yep.
what is the highest dose one should take when you have vitamin D deficiency?
Yeah. That is very dependent on the person. I will say enough to get your levels between 30 and 50.
50.
I have a few patients of mine, now we're seeing more people going through gastric bypass surgeries or weight loss surgeries. They have malabsorption and they may not hold on to the vitamin D as easily. I have some people who are taking a few 100,000 per week, and that just barely keeps their levels normal, right? I have other people in my practice who just need 1,000 a day of vitamin D3, and their levels are fine. So I would say whatever it takes
Doctor,
to get you, yeah, to get you between
to
that
get you.
those levels, yeah.
So, usually what we do, some primary care doctors, they do, or what we do is like, I think it's 50,000 or 100, some people,
Hmm.
50, I think 50,000
Yeah,
micrograms once every week.
yeah.
So,
And that's fine. So the way that I describe it is you have to think about your vitamin D tank like a bucket with a hole in
hmm
it, right? And that 50,000 dose is like flooding the bucket.
hmm
Usually we have about 2,000 IU coming in and out of our
okay,
body daily. But if the level of the
okay.
bucket is low, right, you're
International
never going to
unit.
raise the level in the bucket unless you flood the bucket. And so that's what the 50,000 dose does. So usually what I'll
Okay,
do
50.
is I will recommend that for 12 weeks. And if after 12 weeks we check a level and the level is between 30 and 50, I will switch them over to that maintenance dose of
Maintenance.
2,000 IU daily of the over the counter stuff. And
Okay.
then we see if that's maintaining their levels. You can check in another 12 weeks after that. Then you're good.
Okay,
They don't
so
have to take the big
so
dose.
you're trying to say, so now if our levels are normal,
Yeah.
30 to 50, there's no need to take the high dose. They should just switch to maintenance dose. Then is there ever a time they have to come off of the maintenance
Yes.
dose?
That's when they get toxic, right? Like if the vitamin D levels start going up over 80, I have people cut back.
But if they're taking it over the counter without their doctors and all that, because they're listening to people saying it, I
Yeah.
mean, I mean, how, when do they know when to stop? Like,
I That's the thing. A lot of people are out there doing stuff that we have no idea about, right? So that's where I would really push for people to go talk to their doctors, right? And for us as doctors to ask the questions, what supplements are you taking, right?
Okay.
I will have people come in very frequently and say, I take no medicines at all. But
Mm.
if you don't specifically ask the
Over
question,
the
what
counter.
supplements are you taking, you'll never know. Yeah,
I always ask them, do you have any medication from Amazon, from eBay?
it's true. It's true. The supplement
I
business is
have,
a big game.
I'm like, I have to ask, I'm sorry,
Yeah.
but I have to ask, do you buy any over the, whatever it is, you have to let me know what you're
Yeah.
taking. No.
Here our big one is also Costco, right? Because
Mm-hmm.
there's just rows and rows of vitamins that
Mm-hmm.
you can get. And people take them because you feel like they're natural and it won't harm me, but too much of anything can be a bad thing, right?
Mm-hmm. So now, Letitia also asked the question, said, are there any chemicals? I'm just going to make it
Mhm.
generalize the question. Any chemicals we put on our scalp that you think can affect our hormones?
You know, there are some studies and some questions around parabens and methylparabens and how
Mm-hmm.
that can affect. There are also some questions coming up about silicones and whatnot. I think that more studies are probably needed around that for us to fully understand
Mm-hmm.
that effect. But I usually will tell my patients, like, do a trial and error, right? Even a lot of people, again, kind of going back to the supplement question, will assume that natural products are good for them, right? But some people have allergies to essential oils or the carrier oils. And so, the term chemical may be misleading in that, regular shampoos might actually work better for that person who is sensitive to those other things. So I really think it comes down to a trial and error thing. But the methylparabens and the parabens, there's some question about
Question. About that.
how that affects hair.
Now she asked another question that
Yeah,
how often should one do this vitamin D test?
that's a great question. It really comes down to how frequently your insurance will allow you to cover it. I have in my Medicare patients, they hate covering it unless you have a diagnosis of
Mm-hmm.
osteoporosis. That's the only way that I can get it. And it can be an expensive test out of pocket if you're running it through your insurance. Sometimes some of the community labs have it for a cheaper price. I think that for people who have toxicity, that's another way that you can get it covered is if you code it under vitamin D toxicity because the level is too high, they'll cover it until the levels normalize,
Normal.
right?
Yeah.
And then once you kind of establish what the dose is to keep somebody normal, the assumption is that you don't need to keep checking it after that unless the patient is really, either they have a huge change to their health or they start taking a lot more.
Okay. Okay.
Yeah.
So basically, based on
Yeah.
insurance.
Sadly, yes. Sadly, yes. I mean, I will always, when I'm starting somebody on
Mm-hmm.
therapy, try and check it three
Check
months later. I've had
3 months later.
number of patients um, tell me that they won't do it because their insurance won't cover it and it's expensive out of pocket. So we just have to be mindful of that as well.
Okay, got it. So under diagnosis, you can use it as. So when you the vitamin D, what do you bill it as for insurance?
So I will, for some people, it gets by on vitamin D deficiency. So if they have a low level and I'm starting them on therapy, a lot of times they'll let me check that. Interestingly, non-scarring hair loss and fatigue are sometimes also covered.
Okay.
Um, and then vitamin D toxicity and then osteoporosis
Mm,
are really the major diagnoses, or if there are elevated levels of calcium.
okay.
Hypercalcemia will also allow you to check vitamin D level.
Got it. Okay. That makes more sense. Okay, good. Okay. Do you ever check magnesium?
I every now and then, not specifically in the context of hair loss, more so for my patients who are having issues with their potassium or having a lot of unexplained cramping
Mm-hmm.
or low
Okay.
calcium, I will
You
check magnesium.
check magnesium.
Yeah.
Got it. Okay. That's awesome. Okay. So now, do you think someone can regrow their hair without taking care of the medical problems? Like you said, we talked about
Yeah.
PCOS, talked about thyroid problems, issues. Do you think it's possible to regrow hair without taking care of those medical
I
issues?
I don't.
Why,
I think that
why do you say that? You're trying to make every other person sad
I
now.
know.
So why?
I know. I know. Well, see, we have to be the bringers of truth, right? And
That's
the
right.
thing is that if you are having a metabolic condition that, or some sort of health condition that we know affects your hair, if you're not treating the underlying issue, it's not going to come back, right? And
Okay.
even when you're treating the underlying issue, I had a dermatologist tell me, one hair follicle lives for 3 months. You have to go through two hair follicle cycles to even start to see regrowth, right? So a lot of patients get really impatient. They're like, oh, I tried it for a month and now I'm done and nothing happens. And what you told me didn't work. Well, you didn't do it long enough, right? You got to do it for at least 6 months. And then if you see those little baby hairs sprouting through, you know that you're onto something.
Mm.
And that I think is the hardest thing is getting people to understand that your health is connected to your body in so many different ways, right? How you outwardly manifest, it can affect your skin, it can affect your hair, it can affect your nails. So if you're not taking care of those issues, those other things are not going to get better. There's no magic pill for that.
So, okay, another question. So you're saying that with PCOS, I've heard a lot of patients say they can lose weight with
Yeah.
PCOS. And
Yeah.
is it possible for their hair to regrow with PCOS?
That is a little bit harder, right? It depends on the level of androgens, right? And there's a few different treatments that we do for PCOS. Really, you want to help reduce the androgens, and then you want to help reduce the insulin resistance because those are the two things that are really affecting your hair loss. So, I what I generally recommend is we have to start treating the PCOS and seeing if we can lower the testosterone levels and the DHEAS levels, and if we're bringing those down, that's where I see that regrowth, right? But it really takes what I call a multi-faceted approach to doing that, right? So you're treating the medical part. There are, the treatments for PCOS can range from birth control pills to spironolactone is a great one because it reduces the level of testosterone by increasing the amount of estrogen that's in our system, and that can help with hair. And then treating the weight will also do that for patients that I've seen who have been able to lose weight. And that's a tricky one too, because when you're losing weight, sometimes you can lose hair if you're not eating enough protein. But if you're losing weight in a healthy way and your insulin resistance is going down, you will see the scalp hair start to come back over time. But the problem is that if you've had it for a very long time and those hair follicles are just done, then you're kind of between a rock and a hard place. You may not see,
Mhm.
you would end up in an office like yours, where, is now that I've gotten all of my metabolic stuff straightened out, Dr. Achefu, can you help me regrow my hair, right?
That's
Yeah,
right.
yeah,
That's right. So usually for clients that have a lot of medical problems like PCOS, and I mean I can take care of it, but it's very important for them to see the right specialist.
yes,
Like if it's their primary care doctor that can draw the labs, if it's their their OBGYN, or like you said, menopause specialist, or you know, but obesity medicine, I have to send them. I need to get
yes,
clearance, because I don't want to think of 100 things at the same time. So I need to think about your hair. I can't be thinking about your leg, your feet, your
yes.
hands, you know,
we all have our lane, right? And I
a
think
lane. Yeah. So I try to stay in my lane as
yeah,
much as possible. But once I see someone is compliant on their medication, then I can work with
yeah,
them. Then I just follow the process.
yeah,
Especially, I have a lot of people on GLP-1 medications that are trying to lose weight. So I
yeah,
follow them. I follow their journey
yeah,
because I need to know what's going on with their hair because I have treatment for them. I have a
yeah,
treatment protocol for them. PCOS, I have a treatment protocol for them. So that is what's very important. So compliance is very
yeah,
important to me.
yeah.
And that's really how I follow my
I
clients or
know. Now I
patients.
need to send my patients down to you.
Please.
I see that there's a question in the chat
Yeah.
from Letitia again about do you work with hair practitioners? I don't have anybody specifically, right, that I is in my office, but I do have a list of people that I would send to, like derms who do, or aesthetics docs like yourself who do the
The
hair
hair.
transplant stuff. But
Mm-hmm.
we have to get those metabolic issues straightened out first because it's not going to work otherwise,
And
right?
let me tell everyone right now that will you honor us if we invite you? We're going to have like a conference for hair loss practitioners.
Oh,
Will you do us the honors? Is that how you say it? I think that's how
yes.
you say it. We're trying to do it May, probably either in August, May, August, one of those. I don't know. We're gonna
I
take
would
care of
I
it.
would love to. Should my schedule allow, I would
Yes,
I,
that's what I
I
said.
would
We're
be
gonna make sure
honored.
we
Thank you.
coordinate your schedule because they really want to know. you know. So we're trying to get everything together before we put out the dates and, the time and all that. So, because they want to know about what to do. Most of them are also like they're really, um, some of the hair loss practitioners are really, sometimes they're confused,
Yeah.
because I mean, if you're not a physician or into health, or like, if you're not a healthcare practitioner, basically medical health, that's what I'm talking
Yeah.
about. You don't really know the process. You only know this person is suffering from hair loss. And most people do emotional treatment. Let me put everything on my hand, see if it's going
Yeah.
to work.
Yeah.
So, and I don't believe in emotional treatment. So,
I
yes,
I
I
would
don't believe in emotional
absolutely
treatment
agree
because
with you.
that's one thing that I see. So, will you do us the honors? We'll coordinate with you, talk to
I would
you.
love that.
And it's just going to be, even though it's just to give us like 1 hour lecture, just, sit
Yeah.
down and answer all their questions. You can see how many questions.
Yeah, I would be
Yeah,
honored. I would really
yeah,
love that.
yes. So that, and if I have any other um, occasion, conference I'm going for hair loss, I'm going to reach out to you
Yes,
and,
please
so that they can
do.
invite you and
Yes.
so that we'll go from there so that they
Okay.
can
Well,
so you can talk to
would
them.
love to have you on my podcast at some point talking about this as well,
I'll be here.
for especially for all of our women who are in that perimenopause, menopause age range where they're feeling, you know, feeling the weight of losing their hair,
Okay.
right? Yeah.
Yeah. So let's talk about menopause, a little bit about menopause, like,
Yeah.
5 minutes, because it's a big thing, menopause, like,
Yeah.
So what do you say about hair? Do you always see hair loss in menopausal women, or is just 50-50 like, percent, or what do you say? I can't hear you. Can you hear me? Okay.
My cellular did a weird thing right now.
Okay.
Sorry about that. Can you repeat the question
I
for me,
said,
Dr.
how
Patil?
often do you see hair loss in menopausal women? Is that usually the first sign? Now, like when we say hair loss, I want people to understand that you have hair thinning.
Yeah.
From hair thinning, you get to the baldness, okay?
Yeah.
Or we have the hair shedding, which is like, losing chunks of it. Like you said, they bring all the hair in like a Ziploc bag or
Yes.
something to show you. So that likely might be hair shedding. So how
Yes.
often do you see any of those? I just don't want to say hair loss,
Yeah,
any
I
of the
see.
hair issues.
Yeah, I see both. I would say in menopause, if you don't have any underlying issue like PCOS, it comes out as shedding. And, a lot of that has to do with just the fact that I mean, think about in pregnancy, right? Our estrogen is super high then. And you have this like, or at least I did, I had this glorious pregnancy hair I was like, wow, I should be in a shampoo commercial right now, right? And then, of
Yeah.
course, like 4 months later, it all falls out. And, you're like, wow, I have a new bathroom rug now that's made up of my hair. This is not good. But it's in pregnancy when your estrogen is really high, you get that really thick hair. What's happening in menopause is your estrogen levels are declining, right? So you see
Declining.
that diffuse thinning, and it's not in everybody. It's not the first symptom I see. It really is variable in who that will affect. But in my patients who have PCOS, sometimes what I see is their scalp hair loss gets worse, right? The other thing that I will see is that with the female pattern hair loss, if there is a genetic predisposition to having female pattern hair loss, I will see that get worse during that menopause time period, right? And that's where perimenopause, menopause, and that's where I really talk to them about, okay, well, what did mom's scalp look like, right? Did your mom have hair thinning? And, let's look for all of these medical issues. And if it's not improving with that, then we're going to send you to a dermatologist because at that point maybe spironolactone and minoxidil and whatever other treatments they have will be effective. If that's not effective, then there is all of the other hair restoration techniques that you specialize in that are very important. And sometimes it's a combination of all of those things.
Yeah.
But yeah, but I would say it's variable. I see both.
Okay. So I think she's asking, Letitia also asked, which type is more common? I think she's asking if hair shedding,
Yeah.
hair loss, hair thinning, which is more common with
I think
menopause.
my experience is going to be skewed in that because I see so many women with
Yeah.
PCOS.
Yes.
So I would
Yes.
say in my
Eh,
experience, I see female pattern hair loss more, or like the androgenetic
yeah.
alopecia more than I see just diffuse shedding. Diffuse shedding I
Yeah.
will see in people who have thyroid disease,
Mm-hmm.
or menopause without any of
Mm-hmm.
those other things. But just given the shape of my practice, I see that more so.
So what I can say to that is that hair shedding cannot happen to anyone.
Yeah.
So that aside, you can see hair shedding even in trauma. You just had an accident,
Yeah.
stressful situation, surgery, weight loss surgery, whatever. You can have hair shedding.
Yeah.
The only down part of hair shedding is that if you're already dealing with hair loss, female part and hair, it can worsen, becomes more
Yes.
obvious.
Yes.
So hair shedding is just in a whole league on its
Yeah.
own. So I don't really classify hair shedding as type of hair
Yeah.
loss. It's not even hair loss. We don't. It's hair shedding,
Yeah.
because anything can trigger it. Nutritional deficiencies,
Yes.
your thyroid hormone,
Yeah.
so many things. If something is likely off, even
Yeah.
stress
Yeah.
from work,
I
even there's
see a
something
lot
we
of
call
that.
trichotillomania, people
Yes.
pulling their hair, they're anxious, they're pulling their hair, they don't even know it's happening. So that can also worsen if you're already dealing with hair loss.
Yeah.
So
That's very true. Did
yeah.
you see, I have a question for
Mhm.
you. Did you see that increase pretty substantially during the
Oh
pandemic? Yeah.
yeah. Oh yeah.
Yeah.
Oh yeah. Because even within the pandemic, it was so stressful. The anxiety levels, especially we that in the health field,
Oh,
it was so
yes.
significant. Yes. So significant. Yes. It is. It is. It is. And you can't even, the problem with that is that you can't treat the trichotillomania, which is hair pulling. You can't treat it. We can only give you something coping mechanism.
Yeah.
You know,
Yeah.
we have to give you coping mechanism. We can actually help you instead of you to pull it. We actually use the rollers,
Hmm.
so that you can use the dermal rollers that have sharp ends.
Yeah.
So instead of you pulling it, you still have that sensation.
Yeah.
You're rolling the scalp. So
Yeah.
it
That's
lessens it
interesting.
lessens it, and we can also give you some medications. I try to stay away from giving, there's some
Yeah.
medication that we can use, but is it proven to really help? No, it's
Yeah.
usually cognitive therapy and
Yeah.
all that. So it's not, yeah.
That's
So she's
fascinating.
asking what type is more common with menopause? Is it scarring or thinning? So thinning is more common with menopause.
Yes.
Scarring is a whole different,
That's
is
a
a
whole
type of hair loss.
other ball of
Yeah,
wax, right?
so
Yeah.
no. So thinning is what we see because menopause, if you understand the concept of what's going on, hormonal changes and all
Yeah.
that, that's what's going on with, it leads to from hair thinning to the hair loss.
Yes. Yeah.
So we see hair thinning more of that. So scarring is a whole different ball game. So thank you so much. So we're almost like, I mean, I feel like I keep talking,
I know. This
I'm
has
like,
been so
what else do
fun.
I need to?
Thank
I
you
need
for
to ask all
having
the
me.
questions now, but now, final words for us. Final words for,
Yeah.
conclusion, what you tell, every woman out there and also men. Let's not leave the
No,
men out of this because
no,
they
let's not
think
leave
it's
them out.
yeah. So like, what would really your final was for women? Because there's really a stigma about, most people don't talk about menopause a lot,
Yeah.
even because there's so much you can say about menopause,
Yeah.
but really, I know that the first sign sometimes the hair thinning, they notice it because it's always something that will trigger you to go seek for help.
Yes. Yes.
So usually it's their hair because, like you said, the hair is the beauty for women.
Yes.
So, what are your final words for women,
Yeah.
menopausal women, PCOS? Like, what are the final words?
I would say, there are people out here who are physicians and other providers and practitioners who want to help you, right? And while there is a stigma around talking about this, right? The only person that can advocate for you is you.
Oh,
And
wow.
take that first step. Go do it. We have one life and you can either choose to live it, in fear and sadness about what is happening to you, or you can go out and proactively seek help. And I would say, you know, step away from that and you take care of you. Go seek out that help, and all of the community that is there to help you will lift you up and want to be part of your journey. So,
Awesome.
yeah.
Awesome. 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 Now, how can our audience connect to you now? How can they find you? We have to ask that question just in
Yes.
case they missed it in the beginning. So they have
Yeah.
to, have to, have to.
Well, thank you. So they can find me on my social at my handle at Dr. Patil Sisodia, or at the one for my podcast at Reset Recharge. There are also links to my website on my social profile. So if you're interested, you can find me that way as well.
Okay. See? So, guys, I don't want to hear anyone saying they don't know about menopause and hair loss. I don't want to hear any of my audience to say that Dr. Patil didn't tell them this. I mean, she literally told us. I don't know. I don't think there's any other thing there. I could have ever asked you, except for coming to your office to say, okay, show me the labs. I don't know. I mean, you've basically told everyone what we should expect, what we should look out for. So even when your doctor doesn't order all the labs, say, hey, doc, Dr. Patil said, even if my thyroid is off, I'm taking biotin, you need to recheck that. So you see, knowledge is power, like, you know.
Well, and that's why coming together like this in the way that we did, two totally different specialties talking about where we overlap is so important because
So
everything is interconnected. And Dr. Achefu, thank you so much. This has just been a joy, and I
no,
want to come learn more about what you do and all of the
thank
different
you.
treatments you have to offer.
Thank you.
I have so many patients looking for that type of health and so many questions. So
And
I'll reach out to your assistant and make sure that I get you on my podcast as well.
thank you
But
so much.
yeah.
And I do, virtual consults.
Oh,
So
good.
if I need to draw any blood test, like I just send you to the doctor that just referred, this is what I need. So I
Oh,
coordinate
interesting.
with the doctors. I don't have to do it. I can see the person. You become a physical client of mine when you come to my clinic.
Oh,
So, but I
interesting.
can, yeah. So many primary care doctors, I coordinate with them when they send
Yeah,
their clients. I tell them I need this I need this lab test. I go through.
yeah,
I ask them, have you had any lab tests drawn in the past 1 month, 2, 3 months?
yeah,
If they say yes, I need to see them. If I see they don't have vitamin D
yeah,
checked, these some of these labs you talked about, I say, hey, I need you to check them.
yeah,
So once they check it, I'll ask them, does your doctor do
yeah,
biopsy? They
yeah.
can, or they go to a dermatologist, do the biopsy where they are.
Oh, interesting. You and
Now,
I will have to chat
yeah,
about that
so,
because I would be very interested in knowing how I
yeah,
can get my patients
yes.
over to
So it's
you.
so
Okay.
easy to, right now, we can basically coordinate
Okay.
everything. The only time you need to physically come here is, okay, do I think this person will need a hair transplant? Then they come right in.
Fascinating.
But I need you to have all your basics, everything done.
Okay.
So that's,
Okay.
yeah, so it's so easy to work with me and it's so easy these days. Like,
Yeah.
I don't need to do anything. I just refer you back to the physician that sent you to me. I
Yeah.
just refer you back and you do basically all the job. Take all your
Okay.
money, take all your credit. All I
Okay.
need to do is it's time for hair transplant. I'm
Yeah.
right here for you.
Okay. Well, that is amazing.
Yeah.
And I just so appreciate your time.
You're
Thank you so much.
welcome. Thank you so, so much. Thank you for having.
Oh,
Thank you for coming in. Thank you.
oh.
And remember, I'm going to reach out to you
Yeah.
about the
I will
event we're
keep an eye
having.
out for my
Okay.
emails. All right. Perfect.
Thank you. Bye bye.
Have a great one. Bye
You
bye.
too. Bye bye.